Welcome, everybody, to this edition of Attention Talk Video. I'm your host, ADHD and Attention Coach, 𝐓𝐇𝐈𝐒. Today, I want to talk about, traditionally in the world of ADHD, executive function coaches teach skills, or there's some type of behavioral training. Now, understand that behavior can be changed, all right? And the underlying premise among those types of interventions are that we can mold behavior to conform to what we would like it to. If you'll notice, though, a lot of that behavioral stuff doesn't really work all the time. Well, why is that? Could it be will? Could it just be the person's not trying hard enough? I'd like to put a spotlight on this, is that if you have something that is impaired, okay, or an innate trait, it's not really something that you can change. So effectively, an executive function coach that's coaching behavior is kind of like trying to coach somebody who's short to be tall, or trying to coach somebody to see color when they're colorblind, right? Or trying to coach me to see 20/20 without my glasses. The point that I'm trying to make here is all too often we're trying to look at changing behavior as opposed to looking at what the underlying impairment is and really make an accommodation for that. Right now, I'm working on a program called Cognitive Ergonomics from the Inside Out that takes a look at thinking as a system so that you can kind of pinpoint that. But really, the aha here today is to recognize is that when behavioral training isn't working, usually there's an underlying impairment that needs to be compensated for, not necessarily just try hard. I'm sure a lot of you want me to give you a tip or trick on really how to do that, and I wish I could, but it's not that simple. It really depends on you, the individual, and what you're doing. I can give you a generalization is that one of the challenges of ADHD is a taxed executive function. Working memory is a part of that. Having the ability to hold information in your mind is more limited in capacity. Trying to do work on a cell phone requires you to hold more in mind because you have to scroll around the screen. You can't see as much. And so a lot of times, people run around trying to use tip, tricks, and strategies to solve their problem, but sometimes the underlying issue is the working memory impairment, and the very tools that they're using is a bit of a challenge. So, point of the video is, if you've been trying behavioral therapy, or if you're trying certain skills and they're not working consistently, might be because there's an impairment going on, and maybe we should compensate for the impairment as opposed to just keep trying harder to mold your brain to do what we want it to do. Hope this has given you a moment of pause to think. With that, if you're new to our channel, please hit the subscribe button. If you're an existing person, please make a post. What are your thoughts on this? I'm sure a few people will differ or argue with me on this, but I think if you look at the evidence, if the obvious thing isn't working, chances are you're paying attention to the wrong thing. And in this situation, if you're doing behavioral stuff, it's not working, maybe it's an impairment. We do what we do for you. We certainly like contributions by hitting the thanks button at the bottom. With that, we hope you've enjoyed this edition of Attention Talk Video. Take care.